I'm gonna have brain surgery.
We ask that you protect your servant, Nicholas. We offer him up to you and to your hands today.
I've had epilepsy for a while now, since 2005, when I had heart surgery. And after my heart surgery, I started having epilepsy. And it's just gotten worse from there, so.
He was having a lot of seizures almost every week or every other weeks, and that limited his life significantly.
Great kid, very bright, very outgoing. He's very functional. I mean, he was looking forward to the surgery and wants to be. He's about to get married. He would love to be seizure-free to start his family life, and he's a great kid.
I feel great. I mean, this is great that it's going to be gone. I'll be so happy. I'm on almost 10 medicines a day, and once it's gone, I'll be so happy.
So we knew he has right temporal lobe seizures, right temporal lobe epilepsy, and since he has failed 2 or more medications, we thought it's time to consider the surgical option for him. And we know from a lot of studies that's been done in the past 10, 20 years that surgery is the most effective way to stop the seizures and improve the quality of life in patients who has intractable epilepsy after trying first and second medications.
We did a 2-stage procedure on him, where in the first stage we did remove part of his skull to place leads into and around his brain to figure out exactly where the seizures were coming from.
We covered the right temporal lobe with multiple electrodes. The distance between the electrodes is around 1 millimeters. And these electrodes will be able to record the brain activity directly from the surface of the brain and tell me exactly in millimeters where the seizure is coming from. He went with the wires into the ICU. In the ICU, he had, if I remember correctly, between 8 or 10 seizures. And all the seizures came from a very specific area in the brain. They were all the same. They were all identical.
We localized the seizures and found exactly where they were coming from, because on the MRI scan, often you see an abnormality on the MRI scan that tells you where the seizures might be coming from. But in this particular case, there was no clue on the MRI scan where the seizures were coming from. So we identified the area of the brain that was causing the seizures and removed it.
And so far he's doing great. He's been seizure-free, and I started decreasing his medication. He's very happy.
Well, I got released. I went home. No more seizures. Just awesome. I woke up from surgery and I felt like I had a new life. I said to myself exactly what you asked me. What am I going to do? I have a new life. So I'm starting fresh.